extremely supportive and partial to today's event, as healthcare is my background and I'm deeply passionate about it. So I was super pleased to be invited today to do the opening of this really important session. I'm delighted to welcome you to what is called Health Equals Wealth. How can the UK and Europe work together towards healthy aging? Before we start though, let me please say a big thank you to the International Longevity Centre UK, or ILC UK, and the UK's Department for International Trade, who are the two organizations jointly hosting today's event. Now, what does healthy aging mean, you might ask? The pace of aging populations globally is increasing rapidly. It goes without saying that in 2019, the United Nations World Population Prospects Report projected that by 2030, the number of people aged 60 and over will rise by 38%, which is staggering, up to 1.4 billion. Our longer lifespans, while obviously positive in so many ways, bring new challenges. And these are challenges that countries are often not prepared for as their health systems struggle to cope. In December 2020, the UN General Assembly declared that 2021-2030 is going to be the decade of healthy aging, aligned with the last 10 years of what many of you will recognize as Sustainable Development Goals. It identified health as key to leveraging the opportunities that longer life brings and highlighted ways to improve the experience of older age. A longer life can bring a wealth of opportunities, obviously not only time to spend with loved ones, the pursuit of career prospects, retraining, following hobbies, but obviously also it's hugely important for families, communities, and the economy. Now, where do Europe and the UK fit into this picture, you might ask? Both the UK and the EU have made commitments towards supporting healthy aging, from the EU's Green Paper on Aging to the UK Life Sciences Vision. The UK is home to a world-class healthcare and life sciences ecosystem that we're harnessing to respond to this challenge, with, of course, 2 of the top 3 universities globally for life sciences and a turnover of over £74 billion in the sector as a whole. We're obviously keen to make the most of these assets and invest in healthy aging as we come out of the pandemic. And this is definitely shared both on the UK and the EU side. So today we come together to explore some of these issues. Both DIT and the ILC UK have launched reports that demonstrate that the UK and Europe share both mutual challenges and joint opportunities in this field. How we maximize these going forward, what insights we generate, and what connections we make today will determine how successful we will all be in promoting healthy aging for our common good. Without further ado, you'll be pleased, I'm going to hand over to your wonderful chair today, George McInnes, Healthy Aging Challenge Director at UK Research and Innovation. Thank you and enjoy.
Ilaria, thank you very much for that kind introduction. So to the topic, health equals wealth. And you'd be forgiven if you've been reading the papers or watching the TV recently that for thinking that climate change was the only global so-called mega trend affecting our societies. And while we're still in the grip of a pandemic, so far it's had actually quite a limited impact on life expectancy forecasts. So aging populations, as Ilaria has just illustrated, are still with us. And we're at the start of the UN Decade of Healthy Aging, and how we adapt to both population aging and climate change is set to transform all sectors of society, including how we live, work, and relate to one another. So the need for innovation is clear. I'm also reminded of a paper published in Nature Aging earlier this year on the economic value of targeting aging, which shows that improving healthy life expectancy is not just a moral imperative, it makes economic sense too. Across Europe, to the tune of tens of trillions of pounds and euros for each extra healthy year. So how we age is really key to sustainable economies. And it's also not just about managing health in later life. It requires investment in health promotion and prevention right across the life course. And that needs to be smart, applying technology innovatively to improve lives, and making the most of the opportunities to use data to understand and accelerate the detection of disease and deliver services in ever more person-centered ways. And that's vital if the promise of precision medicine and advanced therapies are to achieve their real potential. So this event marks the launch of the Department for International Trade's paper, Healthy Aging Solutions to a Global Challenge, alongside the publication by the International Longevity Centre, and if I could have the next slide, please, Lily, of short policy reports looking at the economic opportunities of healthy aging right across Europe. Now, in the ILC's words, we've become accustomed to aging populations being presented as a bad thing, but far from being a cost or a drain on public resources, older people's social and economic impact is significant. So health equals wealth, and we have 5 great speakers who will help us explore the opportunities, and I'll introduce them as we go. So at the end, we've also got some time for questions, so please do go into the Q&A function that you'll see at the bottom of your screen, and I see there's already 27 questions lined up there, so plenty there, but do add your questions as we go along. So that's enough from me. So first up, it's my pleasure to introduce David Sinclair, the Director for the International Longevity Centre UK. David.
Thanks, George, and I'll be as brief as I can because so we've got plenty of time for the conversation. For those of you who don't know, ILC UK are the specialist think tank on the impact of longevity on society and what happens next. We work across the world, and it's why we're really, really excited to work with the Department for International Trade here. And we have partner organizations in 16 different countries. Really, really excited to also announce that this week we are launching ILC Europe, a network of ILC partner organizations across the whole of Europe. So really hope we can strengthen the engagement in public policy on longevity and health across the whole of Europe, working particularly with people like the DIT and indeed Brian and others and WHO we have on the line here today. In terms of the work we're launching today, and one of the things that's really striking is that if you look across the whole of the G20, the messages are really, really similar and the evidence is very similar. We're launching European reports today, but we have similar reports across the whole of the G20. And what we find is, as George just hinted at, far from being across that cost, that actually the contributions of older people across the whole of the G20 are both significant and increasing. What we also find, and I think this is where the life sciences and health stuff is extraordinarily important, is that actually keeping us in good health for longer helps enhance the value of that economic contribution. So just to give you a few examples from the reports we're launching today, in Germany, 77% of people aged 50 to 64 are working. In France, 1 in 3 workers is over 50. Over 6 out of 10 euros in the Spanish economy was spent by households led by those aged 50 plus, and by 2040 in the UK, 63 pence in every pound in the UK economy will be spent by older households. So we know already that older people are contributing to the economy in terms of spending, in terms of work, in terms of also actually indirectly in terms of care contributions and volunteering. And one of the sort of really striking bits of analysis we did when you look across the whole of Europe was a piece which found that actually the unpaid contributions of older people just through volunteering and caring contributes more than what Europe spends on defence. So very, very significant amounts of spending going, of value coming through unpaid as well as paid contributions. What we also know, and I think this is really, really core, is from our analysis, is that across Europe and across the whole of the G20, those countries that spend more on health, those countries where you spend more on prevention, result in people working longer, volunteering more, and spending more. So there's a very, very direct relationship as we sort of slowly come out of, hopefully, COVID and some of the real challenges around, look, actually health shouldn't be just seen as a cost. There is a massive opportunity here if we get health right. And I think that's a really, really important message for policymakers. And I think the challenge for policymakers going forward, and I think there's an interesting question here, and this is from a piece of work we did sort of last year or the year before. One of the things that's really striking is if you look between sort of 2009 and 2017, actually, if you look at health spending, actually spending on prevention fell over that time across the G20. And I think what we really want to, I suppose the note of caution and the worry is that given we've identified at least a correlation between spending, between good health prevention and economic value, what we need to do going forward is make sure the investment in health continues going over the next sort of few years as policymakers across the world and across Europe think about how to adapt to a sort of post-COVID world. So at that point, I'm just going to stop. Clearly, our reports are on the website. Please do get in touch with Lily or myself, and I should take this opportunity to thank Lily, who really did all the work for today when I've just sat here and read some stuff. But a huge thank you to Lily for all of her work on this piece of work, and look forward to the conversation.
David, thank you very much. And I'm sure we're going to come back to that point that you've just raised about the balance of investment between prevention and cure, because that's going to be so key to trying to get innovative services in the market. Moving on now, it's again my pleasure to introduce Linda McGee. And Linda is the Health Innovation and NHS Specialist at the Department for International Trade. She has a long background in this field. And Linda, it's going to be fascinating to get your perspective, particularly given all the changes over the last 18 months.
Thank you very much, George. And again, a great pleasure to be here in this joint event with ILC and ourselves in the DIT. Next slide, please. Thank you, David. And as we've mentioned, we've also launched a report recently, and I'd just like to start off, next slide please, by just telling you a little bit more about DIT for those who are less familiar, and particularly the directorate in which I work. Ilaria has set the scene for our collective challenges for our ageing population and what we have in the UK to offer. So it's just to mention Department for International Trade, DIT. Our job is to secure UK and global prosperity by promoting and financing both international trade and investment, as well as championing free trade. Within the Healthcare, Life Sciences and Chemical Directorate, we help global companies to invest and grow in the UK, and we support UK-based companies to export. So this work supports the pipeline of development of health innovation that could benefit our citizens, as well as working in partnerships with our overseas governments and global organisations to promote health and prosperity, the very reason we're all here today to talk. Next slide, please. So this report is developed with our UK partners, including UKRI, of which George is a member, NICA, ILC, and Digital Health and Care Innovation in Scotland. And we also have a number of international partner organisations featured in the report, and I'll come on to that in just a moment. There are 4 areas of strength across the healthy ageing pathway which we focus on, and a lot of our focus is around the technology and innovation, as you can see there. So we've got prevention and health promotion. George and David have already highlighted this. We've got assessment and diagnosis. We've got the importance of treatment and rehabilitation to enable people to live those full lives, and long-term care. And within these pathways, the UK is able to offer both its expertise and its strong infrastructure, and this is underpinned by the UK's life sciences ecosystem. It's a dynamic space for bold, high-risk scientific research and application in medicine, with clusters of companies at the forefront of this science. And this includes areas of AI, data-driven technology, and digital health, and medical and health technologies. We've also partnered with these 6 international organisations to look into the challenges in these global regions, and you can see the wide variety. And this underpins our DIT approach of collaboration. We have strengths in healthy ageing innovation in the UK, while international regions have made great strides in others. So this report is building on a concerted healthy ageing programme by DI staff, particularly in Europe, over the last 18 months. And it's already highlighting the potential of how we can work together to support and improve the opportunities for our citizens and our businesses. Next slide, please. These are the areas that highlighted, if you like, or the conclusions that we can draw from the report with the contributions from so many. We shouldn't just focus on specific conditions. And in the UK, UK researchers are really diving beneath these conditions to explore the mechanisms of the ageing process. And this has been highlighted in the recently published Life Sciences Vision. We've got positive ageing, and how do we relate to citizens as they become older and manage conditions? We really have to embrace this. Technology, and this is the areas I've said where we have a particular focus frequently, is at the heart of addressing these issues. It can help us adapt more quickly and find new ways. We have to integrate everything we do across the various sectors. And NICA and IUK's programmes have also highlighted this. Data matters. And advanced therapies are also important and a real world-leading capability in the UK. And we have a new era of senior living. So it's also important to, as George has talked about, the impacts of the COVID pandemic, we have to focus on some of the challenges there. Not only are older people more vulnerable to the virus's more serious effects, but the pandemic has exposed some of the other existing issues, including lack of digital skills and exacerbating social isolation and inequalities. These are things we must all take into consideration. So to end on item 7 and the new era, next slide is fine, thank you. In the UK, we are seeing a new revolution in the way older people live. We have technological developments and we have more user-informed design processes, enabling people to stay more independent for longer. Our retirement and care villages are starting to offer a very different experience, and that's consumer-led and enriching. So joining together to identify and promote these innovations across the UK and the EU is the way forward for health and wealth. Thank you.
Linda, thank you very much. And great sort of explanation of the real breadth of the domain that we're talking about, right from the prevention to the long-term care, and some really, really serious life sciences stuff in the middle there. So thank you very much for doing that. Next up, a warm welcome to an old friend and a champion of the agenda of joining up across Europe. So Brian O'Connor. Brian is founder and chair of the European Connected Health Alliance. So Brian, the floor is yours.
Thanks very much indeed, George. Perhaps I'll give the next slide, David, or Lily. Just to say, just interesting, I looked at the number of people who have joined us online, and it's fascinating for me to see, well, first of all, welcome to everyone. My thanks to ILC and DIT for organising this. thank you particularly to you, David, and your team for the excellent reports that you produce. And then I think you've taken the biscuit with this one, because I do think that this highlights the one thing that I've always believed makes things work, which is about economy and money. If George referred earlier to the, you'd be forgiven to thinking nothing matters in the world except climate change. And of course it does matter. But I think it's taken on a new twist when people realize there's an opportunity in it. That it's not just like, as the Chinese would say, wei zhe. When they say there's a crisis, there's also an opportunity. This is an opportunity. And as an older person, if I can call myself that, in fact, I definitely can. Other people say a lot old, quite old. The reality is I'm really interested in this. And I spent the last 20 years hoping that all of you would come up with lots of solutions which make my life, whatever I've got left, much nicer and more helpful, more livable. So I'm hoping this will be another step in the right direction. Some of you will remember an initiative launched by the European Union about 10 years ago, I think almost, called I think it was called the European Innovation Partnership for Active and Healthy Aging, EIP AHA. I know I can see a number of names on the list of people who participated in that. We did from the very word go. George, you remember this well. And we participated in the first ever meeting held in Brussels to get that off the ground. I remember being in B3, as it was called, which reminded me of my school days, but actually was to do with the integrated care aspects that Linda touched on. So that itself came to an end, I think, at the end of last year. And that was a pity, because it did join up UK, Europe, and others in addressing specific elements of this issue and this importance. So maybe I could say that we're trying to organise or do something similar. Maybe on a bigger scale. Could I have the next slide, please? We are a not-for-profit organization, a membership organization. This is actually our 10th anniversary this year. We decided at the very beginning we were not going to be like everyone else, which tends to be an attitude I have, I must admit. But the reality is that what we tried to do was to bring together all the sectors. Because what were the obstacles? What held us all back? Often what holds us back are, number one, there are brilliant things happening everywhere, but many of the people doing those things don't know that other people are doing similar things and they could easily collaborate. We have tried to create a series of methodologies, of processes, platforms, if you like, which allow everyone, whatever the sector you're in, whether you're a government, a hospital group, a health system, industry, patient groups, etc., to actually connect. Now, it's easy to say that. We all have aspirations of connecting the dots, but actually you have to make it happen. So we have created our own version of our platform. Maybe the next slide will demonstrate that. And this is where we decide to create our international network of ecosystems. We all use the word ecosystems these days. It means different things to different people. To us, let me explain. It means they've got to be permanent, because I do not believe you can build a strong relationship of respect and trust with someone in a one-off event, much value as they are. You need to have permanent connections. So we have permanent ecosystems, usually meet 4 times a year in their own particular region. They have to be multi-stakeholder, otherwise we don't do them, because it is the connections that add the value. And the third thing is they've got to be in a defined geographic area. I remember our very first one was in Manchester, based on the department in Manchester University. It's now grown considerably. And that's where, in fact, I think I met Linda in our first meetings. What we have done is tried to create these ecosystems, not only across Europe, but gradually people around the world have asked us to do the same. So we have about 70 of these happening now. This gives us an intelligence network, an ability to connect people. And also, final bit on that is that it allows us to literally collaborate, as the word was used. I think my last slide might be helpful just next, George. And that is that with the demise of the EIP AHA, we decided that we didn't want people to be homeless, as someone said to me. Someone from Italy called me and said, "What am I going to do? It's gone. I'll be homeless." And I said, "Well, you don't need to be homeless. Why don't you join one of our thematic ecosystems where we take a cross-border view of some of these issues you'll see here?" I'm hoping you will see this as a method of being able to A, stay connected, B, to tackle specific problems, and C, to learn more about what other people are doing in other parts of the world. So that's my contribution today, George.
Ryan, thank you very much. A sort of a reminder, if you like, that we're not alone, that this is a shared challenge and a really global shared challenge. I think also a reminder with your ecosystems point. So this is an area where the active and assisted living program in Europe has been moving for some time to really understand the role of bringing people together, but also what are the rules of the game doing to change the way that those ecosystems behave. Finally, I just want to sort of get an advert in, which is the UK is still signed up to Horizon Europe. So collaboration in research and innovation is still very much on the agenda and a key part of the conversation today. So, and with that sort of thought about the collaboration on innovation and the need for innovation, it gives me sort of great pleasure then to bring in Nick Palmerini, who is Director of the National Innovation Centre for Ageing in the UK. So Nick.
Thank you so much, George. Such a pleasure to be here with you. Hope you can see my screen. Yep. Yes, yeah, thank you. Thanks for the intro, so interesting. Thanks for all the participants. I think there is no collaboration, there is no future if you don't collaborate. So collaboration, I think it's again the key. And I think what I've been saying before is so relevant. So let me share how we are bringing forward from the National Innovation Center for Aging our way of collaborating with others, introducing what we have framed as our strategy. What you see here, it's named Aging Intelligence. Basically, our mission is probably not so different from many others when you see the attempt of harnessing the business opportunity related to longevity economies, which is something that it's obviously we have to look at, because we think to leverage an impact over a better, more equal world, we have to develop and launch and support an economy that could be more equitable, and then again could be and could reach a broader population. That's why we do it through what we think are the key ingredients to make it happen, which are human experience, ethics, data, the collaboration we're discussing about today, the emerging technologies that we have to keep in the landscape, and the innovative business model. But if you ask us to frame the mission, let's say that our mission is adding intelligence to aging and longevity. So intelligence for us is the key word. So what kind of intelligence are we talking about? We're talking about 3 layers of intelligence. The first one is the intelligence of us as people. So what we're doing here at the center is just engaging as much as we can people in all the activities we do. We run a community, let me say citizen active community. It's named Voice, which is based here in Newcastle, and it's spread all over UK, but also abroad, and I will share in a second. But the core element here is just the intelligence of people that typically in the process of aging has been put aside. So when you just get retired, typically that experience, that knowledge is just like frozen in the retirement frame instead of being brought back again. That's what we want to do. We harness that knowledge and experience and make it actionable to others. The second layer of intelligence is all the intelligence that we produce. I think you've seen already many layers of intelligence, but I think it's important that we look what all these intelligence are generating. There's a lot of solutions out there that we tend to reinvent the wheel. So our purpose is just to leverage what it's already working, what we can learn for what it's already working and improve. And if it's something it's missing, to push the intelligence to deliver what it's missing, but not avoiding to reuse what is existing out there. And finally, we're trying to frame all this knowledge in an actionable data platform that should allow everybody to have access to these 2 combined intelligence. So if we have an intelligence generated by our experience and summed with the intelligence of what people think about those experiences and those innovative technologies, here you go, how we can somehow nurture the future of the economy, as I mentioned before. As I said before, we have a community, which is integral part of what we do. And you could see this community is growing. So we opened the first chapter in the United States almost 6 months ago. We're opening in Canada right now. We aim to open in Italy in beginning of 2022. And we have Australia and Singapore as our target countries, with China, as you can see there in the background, and you'll discover why in China. Today, the community is roughly 9,000 people. And the importance of having communities, which is broad in terms of age, from 50 to the stakeholders, that's what we're doing today, and from different cultural backgrounds, suggests that this is a global topic. And the more we learn from different cultural backgrounds, we think the more we can contribute to a collaborative engagement. Basically, this is what we do. So we support, with the engagement of people, the innovation play. We do a lot of work in also understanding people from different perspectives, leveraging the technologies, mainly cognitive computing, which help us to understand a lot more about ourselves. And computers prove to be quite well shaped, to deliver that knowledge that we can't understand from only the explicit feedback. So what are we doing? Just understand more from people and engage the innovators in the play, providing the insight to typically lower the risk of innovation that it's perceived yet in this field. We do it through this dimension. So it's not only healthcare, as you can see, it's from these 8 verticals, which are, let me say, the classic industry in which we play today in our life. And we do 3 over these 4 dimensions, which are cross-cutting all the industries. Healthy longevity, ethics, intergenerational narrative, and climate change, let me say, are our mantras on top of which we figure every project, to provide the entities working with us, the organization working with us, not only a return on investment, but also a return on society. Right now, we have many programs, but I focus on the 4th one, which I think are the more relevant for the discussion of today. The first one is an agreement that we have with the UK, between UK and the Chinese government, to basically explore the opportunities of China rapidly aging society. I would say it's mainly for two perspectives. The first one is about mobility. So there's a lot happening in the transition from rural to urban areas. And the second is establishing a community in China so we can understand what could be the need of a population which obviously have a heavy weight in terms of demographic transition. The second program, it's called Internet of Caring Things, which is an exploration on how things, instrumented things, can provide us knowledge and understanding about how we are aging and what is our process of longevity. I hope you care about a core difference. So we're not talking about age tech or longevity technologies. In this case specifically is caring things, because we want to explore how to care about the others, how to care about family members, how to care the environment as well when connected to an aging demographic. We have City Longevity, which is a set of tools that we are shaping to deliver to cities that can implement policies to sustain different lifestyle and more healthier lifestyles in cities. And finally, a program called Longevity as a Service, which is leveraging existing digital solution. And we want to democratize the access to this solution to the broader population. Here you can see some of the projects that we have run. And this is just a short selection of what we're bringing forward. And you can see there is a lot of collaboration already with companies that are not necessarily in UK, organizations that are not necessarily in UK. So our, let me say, day-to-day job is just to support the collaboration with other organizations. Thank you.
Nick, thank you very much. You started by saying there was no future without collaboration. You built on the work that Brian was talking about bringing together an international community. And I think showing what you're doing and bringing citizens' voices from right across the world in to inform innovation through your aging intelligence is really inspirational, but a huge asset for any innovator who wants to try and tackle global challenges. And with global challenges in mind, I know I started by mentioning that we were now in the UK's the UN's Decade of Healthy Aging. Beg your pardon, Sir Manfred. So it's my great pleasure to introduce Manfred Huber, the Coordinator for Healthy Aging, Disability and Long-Term Care for Europe at the World Health Organization. So Manfred, welcome.
Thank you, George. It's really a great pleasure to be with you all today. We have throughout this year aimed at strengthening our ties and cooperation on aging health with the UK and other countries in Europe at a number of occasions. I will give you some examples. So I really look forward to our discussions today during this meeting. Now, the themes of the DIT Healthy Aging paper very much resonate with the key concerns of the WHO European Programme of Work, United Action for Better Health in Europe. And I will give you a bit more on the details. We currently working on a roadmap to implementing the Decade of Healthy Aging for the European region. And there are a number of important links to our overall work program, especially 4 flagship initiatives that we have. And they very much touch upon topics that I have heard from the previous speakers. So one is about mental health and well-being. We have a new mental health coalition. The pandemic has shown us this is an area we need to invest more on. There will be a vaccination agenda, of course, for the next 10 years. So obviously, I see it's one of the question and answers. How do we move ahead with vaccination? It's not only about the pandemic. We always had the excess mortality with the seasonal influenza. So this is all hopefully areas where we will have a boost of policies. Another is the digital agenda, and I will say a little bit more about how we work on that with local communities, because that's where it has to happen. A lot of the innovation, that's where has to happen on the local level. This is where we have the support bottom up from the volunteers. And of course, as has been said, many of the volunteers are older persons themselves. And we have seen it, how important they are in their role during the pandemic. And one of our flagships is digital health. So again, that's something that really came up during the pandemic. We need to have more digital literacy, better ways of connecting older people in their communities. So I won't say much more about the Decade of Healthy Aging, which has 4 main areas of work. One is combating ageism, to change how we feel and think about aging. And the importance of that has come up in the launch of European launch of the global report on ageism that we have seen this year. Another is the communities, foster the ability to older people in their communities. I'll say a little bit more about that. Then health services, social services, obviously, and one of the ambitions to have a long-term care system for older people in all Europe. And here I'm talking about the WHO Europe of 53 member states. So it's quite a broad agenda. And I won't go into the demography. Of course, we all have numbers. Since 2010, we had an increase of the median age in the region of 2 years, and we will have by only 2030 another increase by another 2.5 years. And right now in Europe, of the 53 countries already, which has many younger populations, nonetheless, today we have more people every day celebrating their 18th birthday than are born in the region. Now, one of the areas where we work together with a number of partners in UK specifically is our Healthy Aging Task Force under the European Healthy Cities Network. It's 12 cities from different countries. And for example, we have Belfast, Newcastle. In the past, we worked with Manchester, and we base this work on a framework that has been elaborated in a joint project with the European Commission some 5 years ago. Now, of the main things that we have found in a current project on looking into resilience of communities in the context of COVID-19, specifically the resilience of age-friendly initiatives. So what we have found here, again, it confirms some of the topics issues we have heard before. First, how important communication is. We have a shift in many cities during lockdowns to new ways of communication, not only new technology, also having new befriending, for example, phone lines, but then of course also the issue of digital literacy. And another common topic is really on how to make sure that we can engage with older people in creating the environments that really get people out and help to combat loneliness and social exclusion as topics we always have talked about long before, but now the pandemic really has put a new spotlight on these. And I'll stop on here. I'm very much looking forward to our discussions. Thank you.
Manfred, thank you very much. And I think lots of importance of points, but the one that no one else has sort of mentioned, particularly the whole business of digital literacy. And I think that brings in a much broader topic about ageism in the way that our services work. So thank you very much for adding to that. We're going to go now into the question and answer panel session. So I'll ask all the speakers to join us live. I see we've got still got lots of questions, but there is scope for more to come in. So do please, if something has prompted a thought as you've been listening to those great talks, do please sort of add your question into the Q&A. And I'm going to start maybe just sort of, starting with perhaps David. This has been a clear opportunity for some time. So why is it so difficult to get innovation going in this space?
Right, you start with the easy one, George. I think there's a couple of reasons. I think historically we have seen, and you touched on this a moment ago, we've seen aging through a relatively negative lens, and that hasn't been particularly helpful, and that fundamentally there has been and continues to be ageism in everything from design. And I know UK government is supporting, and yourself, George, are supporting the Design Age Institute in terms of design as well. I think so. I think firstly, I think it's a bit of ageism. Secondly, I think it's that we've focused perhaps links into ageism, focus a little bit too much on sort of the negative and the cost side of aging. And then thirdly, I think it's our own fault, and I think this is a big one. Actually, we all deny aging. I know I've said this before. We deny we're going to be like our dads. We deny we're going to our hearing's going to go and our eyesight's going to go. And I think until we ourselves can start to see how aging will change ourselves, it's really hard for us as innovators, designers, businesses to start to see the economic opportunity. Now to turn that round, I think absolutely, from the work the UK government did on the industrial strategy through to this healthy aging report, through to the calls we're getting from other governments as well, what you're absolutely starting to see is companies, innovators, governments all coming together. And I think that's really, really exciting. And I hope that will continue over the next year or so.
Oh, thank you very much. And I'm going to continue that theme, and I'm going to pose a question partly to Manfred, and it's based on something that Issa Dasu Patel has put in the question answer. So I'm going to rephrase the question to be more sort of pan-European. And that's one of the biggest challenges to innovators has been generating any real momentum behind funding, and a mismatch between what healthcare systems are willing to pay, what municipalities and local authorities are willing to pay for care rather than health. So a lot of the emphasis has been on acute care and all the rest of it. What are you seeing around Europe in terms of the shift towards prevention?
Some of the topics that we really have put higher on the agenda at WHO Europe is rehabilitative measures. We have many countries, especially in the East, but that have huge deficits in rehabilitative systems. And I think we see some of these deficits in all countries, also in the Western and high spending countries on health. So this definitively is an underdeveloped area, but also it should be a continuum between treatment, rehabilitation, and then moving into care. And we have very interesting new innovative models, like for example in Denmark, the enabling services. Before you get home care, you get intensive retraining, and only then it's assessed what is it really that you can no longer do and has to do. So there can be a continuum that really can help hopefully come to better and more cost-effective services. I mean, I could talk about the hurdles of more the technological innovations. They're spread separately, but maybe a bit later.
No, indeed, and I think we'll come back to this topic as well. So a lot of the problems that the people that we fund face are just getting access to lead customers and lead markets that are prepared to take on their innovative service. And if it's not a lead one, it's the second one after they found someone. So thank you for that. Moving into this sort of acute area, Linda, I wonder if you could sort of say a little bit more about how the life science vision is moving away from a sort of single disease focus to thinking much more about multi-morbidity and all the rest of it. You mentioned some of that in your talk. It'd be great to hear about how that's happening for real. Oops, maybe I've lost Linda. So why don't I?
Thank you, George.
Oh, sorry. Go ahead.
Sorry, I'm afraid I had a bit of a problem with my connection, so I apologise. I missed the beginning of.
Well, look, I'll tell you. I'll come back to that. I'll So I'm not sure I've got Linda or not. Linda, I'll come back to you because there seems to be some things, and I'm just going to move on
Can you hear me?
quickly, and I'm going to ask Brian a question. If Brian's still on the line. So Brian,
yeah, it's still on the line.
Brilliant, good. We just can't see you on camera, but
okay, my video's on, but anyway, let's see.
It's got a fancy wallpaper for you instead, but don't
there
worry.
You go.
So we've heard lots about the opportunity and all the rest of it. So what more can be done beyond reports and insight and all the rest of it to get this area moving?
Well, I think first of all, the reports and research and gives credibility to a whole lot of people. First of all, it encourages governments, regional and national, to actually see there are solutions, and above all, to see what the problem is. So a report such as the one we're talking about today sets out the real situation, but doesn't just set out the problem. It sets out some of the solutions and the paths we can go down. When I listen to Nick, for example, speaking from Newcastle there, you can see there's a huge amount of work going on in the UK already. And I suppose what frustrates me, I suppose, as I said in my opening remarks, is there's a lot of very good stuff going on, but it is only a small percentage that is known to other people. So one of the things that you are doing now, and I'm glad you're doing it internationally as well, is to promote this credibility, these reports and so on. But in addition to that, by aligning funding opportunities with those reports and the solutions which are needed, you encourage innovators to say, well, actually, I know there's a problem there as well. I've got a solution. I know how to get the money. The key to it is not just the money, however, it is the conditions in which you put on funding. So come back to your point, George. I've had a lot of startups in my life, my own startups and so on, and still working on some of those. The reality is the biggest problem is getting your first customer, because you've got to pay the wages every month. And to keep it alive, you've got to get a customer. To get a customer, you've got to have credibility and some evidence that your product works. You've got to persuade everyone that you're actually solving a problem, as opposed to creating a wonderful idea which doesn't actually solve anybody's problem. except keeps you happy that you've come up with a brilliant idea. So it's a combination of all of the things that are necessary, which is why you need to get, they used to call them pilots. I hate the word pilots, but Manfred mentioned earlier about South Denmark. So I'll just tell you quickly where I think that is working. When I last visited before COVID, Odense in southern Denmark, which I'm sure Manfred may well be referring to, actually was invited by the hospital group there to say, we reach out into the community, Brian. We are not simply a structure, right? Because it's about systems, not structures. And they now have what they call invisible walls for their university or for their university hospital. And what they do is they reach out into the community to link up with the community nurses. I went with a team of paramedic nurses around Odense to visit people. And it is that joined up service which opens up huge solutions, but also opportunities for innovators to say, couldn't I be part of that solution? And so you can't always do it on your own. Try to get into a sort of a supply chain group and bid for the sort of money that Innovate UK and others do supply.
Interesting. I just noticed that a lot of the questions are sort of broadly around what do we really mean by healthy aging. So I just wonder whether we sort of revisit that a bit, and maybe sort of Manfred, if you could sort of lead off and sort of say what from the World Health Organization we think of healthy aging. And then David, maybe after that, if you could come in and sort of say what you're seeing in terms of how governments are interpreting that. So Manfred.
Yeah, thank you very much. I mean, first, of course, the epidemiology tells us that more and more the gains of life expectancy are really concentrated on gains of life expectancy in the last year. So that's, if we have a focus on that part of the life course, it has a rationale behind it for itself. But overall, healthy aging starts in the life course very early, even with, you could say, with preconception care. So we know more and more on how healthy aging has to work through the whole life course, and in particular addressing the non-communicable disease agenda that is a very unfinished agenda in Europe. If you look, I mean, we are the continent drinking most, and obesity starts now at children. So it really needs a life course perspective.
David, what you're seeing?
Great. So two thoughts. I think firstly, clearly, life expectancy is still continuing to increase amongst most of the world. In fact, we published something a couple of weeks ago that showed, like, over the last 20 or so years, actually the biggest growth in life expectancy has been amongst some of the poorest countries. So some actually really relatively positive news. The negative side of that, which I think is pretty consistent, is that actually the relationship between life expectancy and healthy life expectancy, particularly for people in deprived communities, poorer communities, is not great. And I think the challenge going forward is how you tackle that. And of course, the UK government, again, through its target for 5 years of extra healthy life years, is actually sort of sending a really positive message that actually it's not just about how long we live, it's about how healthy we live. And I think that, at the heart of where public policy needs to go, I think it's that. And I think there's then two sides to it, and it picks up on some of the other questions in the Q&A. One is, absolutely, to get there, the focus on prevention, extraordinarily important, and prevention across the whole life course. And there's a couple of questions about immunization in there, and I know DIT have an event this week which I'm happy to share, so we'll share some information later on. Actually, we know in terms of adult immunization, it's not just COVID. Pneumococcal disease, flu, shingles, and indeed new innovations in adult immunization play a huge role in helping people live healthier for longer. And let's not forget, it's only sort of 20 odd years since we ever had an age-related recommendation around a vaccination. So we're relatively a new science there, and the UK is in a really, really good place for that. So I think there's potential there in terms of the life expectancy, life expectancy. I think the other bit, which we're I think is worth reflecting on from some of the other presentations. Yes, it's about the big issues, but it's also about us not thinking about things like and a couple of people have mentioned this, not always, positive aging is a really, really important and positive story, and we really must make that story. But actually what we also need to do is make sure that we are not forgetting that and I sort of touched on this before, not forgetting that certain diseases are a bit more common as we age, and that may be where some of the innovation is. Nick talked a bit about mental health. We know issues like depression, insomnia, suicide, really, really common in many ways in old age. Brian touched on continence, fantastically important issue across the whole life course, yet one of taboo, where actually there is potential for massive innovation in that space. And then there's another question around sexual health, again, another of those taboo topics. So I think, governments sort of get that we're going from life expectancy is increasing. There's going to be a bit of a blip down. There has been massive challenges now around healthy life expectancy. In order for us to really push up healthy life expectancy, we've really got to, I think, focus on the big picture interventions like maximizing uptake of adult vaccinations across the board, but then also, focusing on some of these areas which are taboo topics where actually there is potential for significant investment and innovation. And I think there is across all of these.
Thank you, and thank you actually for bringing out mental health and a lot of those sort of minority questions. Actually, the other elephant in the room is that if you want to address healthy life expectancy, you will find that the people you need to reach out to are those that are largely sort of living with disadvantage. So that's a really tough environment for innovators, because these are almost by definition people who are not able to pay. But Nick, in terms of what you're seeing, in terms of how do you help people innovate for these really tough sort of cases, or tough environments, I'll call it, and bring real benefit into healthy aging?
Yeah, that's as David said before, this is another question that could take the whole session, right, George? And I think we face it every day in the job that we do. I think it's important that we start connecting the dots. And again, the first thing, in my opinion, is just to leverage an economy around the solutions, the innovations, not different from the others. We have to start using some buzzwords that you can easily, let me say, attach to other industries. If I talk to you about artificial intelligence and mobility, or machine learning and mobility, everything makes it's a symphony. You already know what you're thinking. You're thinking about Tesla going around by themselves. But if you use the same buzzwords to aging and longevity, it's still very complicated to see cases beyond healthcare. That's one first point. And the second is, if we connect the dots, and I think there was an interesting question from Hassan, for example, a greener NHS, meaning that we can develop solutions that can benefit the community overall, making solution again that can serve the people, living healthier lives, but at the same time caring about where we are as a society. So we could reach, let me say, a broader population, lower the cost of care, and in the meantime, generate new innovation for our own services. And again, I go back to probably one of the key points that has been said in the beginning. The aging demographic on one hand and climate change are the two big things happening to our planet. There is a huge opportunity to put them together and leverage more equitable solutions for a broader population. This is just one example, George. Could be many others, but I think we have to start thinking beyond what is the surface and see the connection in the background. Probably it's there, the answer to your question.
Oh, good. No, thank you. And I'm going to, we've got Linda back, so I'm hoping that the connection will work now. I'm going to change the question slightly, Linda. I mean, in your talk, you talked about looking at moving the focus from single diseases to try and understand some of the underlying causes and all the rest of it, and that's converting into advanced therapies and treatment and the treatment centres. So I wonder if you could say a little bit more about the advanced therapy scene in the UK.
Thank you, George. So sorry. Can you hear me now?
Yes.
Yes, we can.
Good. So I just wanted to highlight, I know it's not necessarily something that comes up particularly in these type of events. But in the UK, we really are world leading in our approach to advanced therapies, sort of gene and cell therapies. They have the overall aim of treating underlying causes of disease and potentially offering one-time treatments. So, this is really important. We've talked about it for a number of years, but in the UK, we have the most supported cell and gene therapy environment through our cell and gene therapy catapult, and the manufacturing centre is based around Stevenage in particular. And we've now, again supported by Innovate UK, we've got the Advanced Therapy Treatment Centre network, 3 collaborative centres working across the UK, and they're again a world first, and that's all about getting these new technologies to work within the NHS framework so they can be delivered directly to patients in a way that meets the clinical, regulatory and evaluation process completely. I just want to take the opportunity to highlight this particular application of technology to the aging process. And the final part of that story, perhaps to mention, is that we've now got CAR-T therapies, and that was one of the fastest funding approvals in the 70, or now plus 70-year history of the NHS. So there's a real wealth of capability in this area.
Good. And just sort of staying with you, Linda, so one of the remarkable things over the last 18 months is the speed with which the NHS has been able to execute sort of clinical trials for COVID and generate world-leading insight into that. Can you say a little bit more about the digital scene and how that has been a huge enabler for that sort of research? Oh, sounds like we're having trouble with Linda again. So I'm going to move on. We might come back to that. I'm going to give the panel warning because in a minute I'm going to ask you all to say something about how COVID actually has influenced this whole scene. But before I do, I'm going to go to Brian. Brian, what I didn't say in the introduction is your background was in long-term care and care homes. And long-term care is one of the 4 sort of key areas in the Department of International Trade's report. And your current role in digital is...
George, I think there's a bit of a lag on my system at the moment. I'm so...
That's fine. We'll come back to you, Linda. And in your current role, Brian, digital is really important. So can you sort of say a little bit about how you see digital changing the long-term care domain for right across Europe?
Right. Thank you, George. Yes. I mean, I came into healthcare from other businesses I've been involved in, actually simply because I owned a field somewhere and didn't know what to do with it. So I built a nursing home, and then I built another 39 of those, and so it went on. But I learned a great deal from that way before the days of digital. Currently, I should disclose that I've stayed in the whole healthy aging bit and care for the elderly bit, because I'm now involved in a very innovative company based in Ireland, but working in England as well. And from that, I've learned a lot, and that is care at home. I see Joe Killen's on among the audience, and Joe and I have worked for many years on this topic. There, what we've discovered, to answer another part of your question, is this: that COVID has changed everything, in my view. And it should have done as well, because it has allowed us all to talk about topics that perhaps we should have talked about before, but didn't necessarily want to talk about them. Secondly, it exposed for me how poor our service generally is as a country in the UK to the elderly. You've only got to read the papers. You've only got to listen to the stories of people who feel, elderly people especially, feel let down during the whole of COVID with the many deaths and so on in nursing homes. with the lack of care, the lack of money for care across the UK. And what we have discovered on the ground, because this is where you learn in reality, is that we used COVID because we literally could not physically visit people in their own homes. That forced us to accelerate our switch to at least partial virtual care enabled by digital tools. And as a result, yes, you go get the PPE on you, if you remember all these words, the PPE on you. We realized that in many cases, we were the only people who would visit that particular person that day. So if you think about it, there's a loneliness aspect to this. There's just a feeling that you don't want to, they're isolated completely. And as a result, by giving out iPads and iPhones and so on and so forth, and persuading the government locally, which was interesting, because we had to persuade the government that we would still be able to visit people virtually, even though we couldn't do it physically. We were then told by a particular government in one of the devolved nations that if that's the case, we will not pay you because you're not actually visiting them under the terms of our contract. You know, the usual nonsense you get from terminology. Now, thankfully, that government and others have learned since and we are now actively actually providing a hybrid service of physical and virtual. And as to the whole question of healthy aging, many people have told me over the years that elderly people won't be able to use iPads, won't be able to use iPhones. Well, I can tell you my personal experience of doing 3.5 million visits a year to elderly people, not on my own, but with our team, actually tells me the opposite, that many of them are excited to be able to use these relatively simple tools and be able to push on a screen and not have to type too much and so on, but actually to go through it. And as a result, we now have, I think, a better community service and a community atmosphere among elderly people. I think that is true from what I hear from our ecosystems across Europe. They have actually seized COVID, horrible thing that it is, but it is, again, my crisis and opportunity. It has created opportunities for people who have had answers for years, but for various reasons, not been able to make them happen. When a crisis hits, Linda had mentioned earlier, one of you had mentioned earlier about that was the fastest ever procurement in the history of the NHS, right? Well, one of the biggest obstacles to innovation is, of course, the problems you have in trying to get into the NHS and other health systems throughout Europe. So I think that has helped break down barriers. And I hope to goodness some well-meaning people in the governments across Europe don't think that if COVID is ever licked, which I doubt it will be, if it ever is, they'll go back to their old ticking boxes. We were able to bring in innovations which would take 5 years to introduce, bring them in 6 weeks. Let's hope that atmosphere gives us the opportunity which we want.
Maybe that's a great sort of segue into the COVID question, Brian. So I won't come back to you, and maybe ask Manfred to sort of lead off on how you think COVID has influenced this. And I think that's particularly critical because probably 18 or 2 years ago, all the focus was on non-communicable diseases, and suddenly we're in a world of both.
Yeah, thanks a lot. And I really would like to underline what Brian has said, and come back also to your earlier question: what are the barriers towards the spread of technical innovation into our day-to-day budgets of health and social services? And one of the biggest obstacles is really that technical innovation needs to go hand in hand with social innovation. If there are great pilots that have been done, but if you cannot convince governments or local governments or other initiatives to adopt them and use them in their practice, then you just have lost the opportunity. And the pandemic has shown how fast some of the social change can be. For example, suddenly nursing homes that had not time to put into the hands of a person in a nursing home something like an iPad to connect to the family that lives far away, and it always has been a problem that there were very few visits possible. But now suddenly they put an iPad in the hands, and then during Christmas you could connect, and it was possible. So now already we see that some of these experiments are no longer being done because, again, with the shortage of nurses and other resources, this is getting less of a priority. But we need to keep this momentum from the pandemic that shows you can do it. You can do it. You can make use of new technology, and also you can make use of the good investment that you did, for example, in the environments, in the urban environments. If you have green spaces, you could have persons coming out and meeting in the open air, where there was then less risk of infection. And also we have seen that it does not necessarily need to be the latest technological frontier that you use. I've always wondered, why don't we use more of these initiatives where, for example, the telephone line is used so that all the people, with the help of volunteers, can befriend each other. If you are a bedridden person, you not necessarily even want to show yourself on video, but you very much, it has been shown that many appreciated having the chance of making new friends, even over long distances, or even almost doing a world travel just by phone. And finally, I think what we see now is that more administrations are taking it serious to having research institutes and government institutions that sift through all the technologies and see what are the lessons that you can learn from moving from pilots to the scaling up. I mean, let's face it, money has gone with pilots, but too little money has gone with looking into what are the conditions for successful scaling up. And I see Brian is nodding. So I think this is a bit the bright side, hopefully, of the pandemic, that these things have now come up, and we are seeing more of that happening, that also there's an international exchange on saying, well, we have a public health institute that has looked into it, and we now know much more about what works and how to convince our politicians, like, for example, the Nordic Welfare Institute. And I think you are, UK is close, not only geographically to be in contact with these colleagues, but this is what we need right now, and I somehow see that it is happening. Thanks.
And Fred, I think your point about social innovation is absolutely spot on, and that the solutions aren't always high tech, particularly if we're dealing with a population who, quite frankly, are at risk of digital exclusion if we move too far too fast and make assumptions. But thank you very much for that, Nick. From your perspective.
I think that we have learned a couple of lessons. The first one, I think in the first wave of the pandemic, we have learned something that we knew. I think David spotted before when we're talking about ageism. We were all old, we were all vulnerable, and then disposable. So this kind of a straight narrative basically as being accepted by the most was something that literally we were reading in newspapers and magazines. And in the beginning, I think most of the people were thinking that it's exactly normal that you're vulnerable and then disposable, which again highlight where we are from a societal perspective, considering an older population. It's something that you literally put there with some stereotypes, mental stereotypes. So let me say the idea of unworthy life was shared all over the media mainly. And then I think we have seen a second wave. So we learned a second thing that someone realized that was not exactly this way. I've seen a lot of we've done a couple of interesting research on social media, highlighting how younger generations were just raising their hand and say, well, I don't think my grandfather or my father is that way. Meaning that someone showed us that that narrative was not literally only the mainstream. So that allowed us to see the other side of the story, that we're very different. And in our aging process, we're diverse, we're different people. So somehow we are start looking more in details from a societal perspective. I'm not entering, let me say, in the biological perspectives, but from a societal perspective, it helps somehow to realize how different we are and discovering how this pandemic hit us differently from many aspects. We go back to the equality as before. We know, for example, that communities in retired home or skilled nurse facilities, people of color has been heavily hit by the pandemic more than everybody else. Some areas of the countries, for example, Newcastle here in the north has been hit very, far much harder than everywhere else in the UK. So I think it helped us to understand that we are different as individuals, which I think it's something that we should have to remind every time we talk about an aging demographic. And second, helped us back again to learn a story that we knew before, that where do you live, how much access you have to many factors. And again, I'm not just pointing specifically on healthcare, but let me say from the broader societal perspective, how much this is literally making the difference for all of us. And again, let me go back to your previous question about the innovation and how we can make all this innovation happening more equal. I think it's in initiative like the one where we are now, calling everyone with the good ideas, with the attempt to make a change. And George, you sit, let me say, on the observatory that sees all this happening. So you see when the stream of new ideas can literally make a change, and you see when the power of innovation from a broader perspective can literally make the change. I think it's a call to action to everyone to join and then provide and help to make the change. That's where collaboration that we discussed in the beginning can really help.
And then David, so
Thanks,
you a
George.
hard job coming in at the end of that.
No, it's great. I think firstly, and I should, my colleague Lily, you may well know, back in September 2019, she authored a report that on the Spanish flu, where we talked about the inevitability of another pandemic. So a few months before the pandemic, I don't think we take any pride in, so we weren't the only people in doing this, but actually what's really clear is that in the same way that we in much of certainly Europe and America, we've been aging relatively slowly. It's really hard for governments to adapt to changes which you don't really think are going to happen, and they're very slow. And I think what it's highlighted is the folly of ignoring some of the risks that might come. I think what it's also highlighted is that a really useful, I think, debate around vulnerability and age, and where age is not, frankly, is not associated with vulnerability. I think one of the slightly worrying things, clearly we don't necessarily want that message, but one of the really worrying things about that for those of you who geekily like to look at Google search terms and what the most positive search terms are at the moment, is if you look up the word vulnerability in the UK and across the world, there was a massive spike last March, and that massive spike came and went. And I think one of the real worries is that actually that people got very, very worried about vulnerability and indeed the word elderly, and it's sort of come and gone. And I think we need to be really, really conscious and make sure that doesn't happen. 4 other points. I think what it's done is absolutely exposed ageism, both within countries and beyond, and highlighted how much work has yet to be done. We've got Ashton Applewhite speaking at our conference about this, but also there's a British academic called Peter Lloyd Sherlock who's been running pretty much a one-man campaign on the issue of the fact that in many countries across the world, too many countries across the world, what's happening is that the priority for COVID vaccine has been on younger people, and that there are more younger people who've been vaccinated than older at very, very significant health risks. So we have exposed ageism. I think we've also highlighted, frankly, to lots of people how many older people there are. One of the things that's really interesting is I remember last sort of, at the point we were starting to, the COVID vaccine was starting to come out, what you saw was people saying, or look, there's another 4 million older people before you get to my age group to get the vaccine. You know, all of a sudden it sort of started to highlight that, look, there are lots of people in their 70s, 80s, 90s across the whole world. And I think that can only be sort of helpful in the long term. I think it also highlighted the real potential for innovation, which of course is why we're here. You know, clearly the mRNA innovations, but also some of the innovations in treatments show that actually we can innovate and we can move quickly. And I think anyone involved in health innovation has to take to heart that actually there's some real potential. I think another one that's been sort of perhaps flagged over a bit, you know, and then, you know, it is actually, frankly, that the NHS app is really good, you know, and it's gone from you know, 500,000 people looking at with it to sort of 5, 6, 10 million in the course of 6 months. It has the potential to really develop further, and I think that's a really good example of of an impact of COVID that could actually, if we maximize that development, to really help. And then the final point around digital tech, we've been talking to lots of people who work directly with older people. So people, for example, in the retirement housing sector, and Linda mentioned this as being a massive area of growth, and it absolutely is, both the sort of the care and housing and care sector, but also the integrated retirement housing sector and extra care and so on. Actually, one of the things that's really interesting, if you talk to some of the providers there, they will say that last, 2 years ago, they were sending paper letters to people saying, keeping them informed about what was going on in the building and things like that. It was only basically with COVID that they realized that everyone, 95% had an email address. They might not have had a computer that worked particularly well with tech, but actually people were potentially more literate than you expected. And I think that building on the strength of what's been going on in some of those communities, how they've supported people to go online and stay online and engage with partners, that offers massive opportunity to continue to build in terms of offering, as Nick was saying, sort of longevity as a service type products. There is I think that what's highlighted is actually, if we get the message right and product right, frankly, people will go online and buy it.
And interesting, and I'll just sort of add in, I think our own experience looking at what's come through in the last couple of years. We ran some fast response projects specifically for COVID, and to sort of link what Manfred and Brian were both saying. So I think social innovation was a key part of what that was. And Brian, your visiting services were important, but not enough. And one of the changes I think that I've seen over the last 18 months is much more, if you like, peripheral activity. So arts, music, exercise, and things like that coming online in one way, shape, or form. Because one of the sort of downsides of the last 18 months with older people self-isolating has been actually it washes up in the healthcare system as people falling more social isolation, more cognitive decline. And these added value services are actually really sort of meeting a need to actually give people a sense of purpose, even though they're isolated at home. So really interesting. We've got a couple of extra minutes. I'm just going to check with Linda whether you can actually hear us, Linda.
I can hear you. Yes, thank you, George. And I haven't got my video on because I think that's one of my problems.
Okay, no, lovely. So I just give you the sort of finishing question before we wind up. I was asking you before just to sort of say something about the data infrastructure that has allowed the UK to conduct some very rapid and really impactful trials during COVID and get results out about what was clinically effective. That's clearly built on an investment over the years. So how do innovators access that sort of capability, and where's that going next?
Yes, and I did catch the end, I think, of what Brian as well as what Manfred were saying in this area about integration and bringing things together. So the key, and I think others have said all this, is we must learn and build on what we've been able to achieve during COVID. Data, the ability to draw data from a number of different sources, was able to inform the studies. We've got to keep that going. There are new ways of carrying out studies that are, if you like, virtual, digital, or you don't necessarily have to get patients to come into centres. So that's an advantage. It's an advantage to people who are maybe, you know, more in their homes, but they can engage in things in that way. We've got a whole set of guidelines for innovators that relate to AI and data-driven innovations. I think my colleague Hassan, I know he was on the line earlier, so I think, you know, Hassan is my expert colleague in that area, in that whole digital innovation. We've got the Health Data Research UK centres for enabling more innovation to get more quickly to patients. And I think there are now 9 to date, and they cover both clinical areas, for example, cancer, mental health, heart disease, and there are also more general data hubs which are looking at enabling trials digitally. So I think the combination of all of the connectivity and interoperability that we managed to achieve with COVID, combined with these supported hubs to bring data together and work between academics, clinicians, and industry to utilize all that data and richness of that data to support innovations, will be very important in the future.
Linda, that's great, and I'm sorry we've had so much difficulty bringing you into the conversation. I'm going to bring this session to an end now. Particular thanks to our speakers, Manfred, David, Nick, Brian, and of course Linda, for actually firstly a really fascinating insight and conversation, but also for all the work that you're doing and continuing to do in this space. Thank you also to the audience. There are far more questions than I could ever have got through, and really sort of insightful. And just, it's been great to be joined from people not just around the UK and Europe, but I see we've had questions coming in from the Dominican Republic. I know we've had people joining from Australia. So real interest around the world in what this can do. And then finally, thank you to the Department of International Trade and for the International Longevity Centre for setting this up. And if you haven't already, do go back to the chat and download the links to those 2 reports. So with that, I'll bring this to a close and just give you a sort of virtual thank you to everyone for their help.